This was a 53-year-old male patient who essentially had feeling of heaviness in the left side of his abdomen. This can be due to various reasons, and he was being treated for acidity and bloating and all these general symptoms. When he came to us, the first thing after taking a detailed history, we found out that this heaviness was gradually increasing and was constant in nature. It was not something that was coming and going or related to some kind of food. But when we put our hand on his tummy, we found a very hard mass which was sitting very obviously on the left side just below the chest. So that set us to investigating him. We first did a simple ultrasound which showed a large mass measuring about 20 centimeters by 14 centimeters, which was in the left side sitting on top of the kidney. This was followed up with a CT scan which showed the mass in more detail, showing it to arise from the left adrenal gland and in close relation with the stomach, the pancreas, the spleen and the left kidney. Now what is the adrenal? Now the adrenals are bean-shaped glands which sit on the top of the kidney. Though they seem very innocent and small, they are actually one of the most important glands in our body. We always keep talking about adrenaline rush when we see an IPL final or we are doing some adventure sports. Now, what is this adrenaline? This adrenaline is an hormone which increases our pulse rate and sets the body up for a fight or a flight reaction. This was designed so that our senses become more acute, the body becomes tense and ready to do some action. That is why it is called as an adrenaline rush. And this adrenaline hormone is secreted by the gland called as adrenal, which sits on the top of the kidney. It also secretes a host of other important hormones like corticosteroids and other hormones which are important for various metabolic functions of the body. We went ahead with a surgery which involved an open surgery, carefully dissecting off the mass from all these important structures, and we were able to preserve the left kidney as well. The mass was removed with the patient being absolutely stable during surgery, and the final picture of the mass showed that it was weighing about 1 kg 620 grams. The patient had an uneventful recovery and the final histopath showed adrenocortical carcinoma. He is now on the regular follow-up and back to his work.